We've got 5 more minutes, so make your interventions speedy and fascinating.
So thank you, Layla. So I'm coming from the mental health side, so not from the design side. And I'm with the Harvard Program in Refugee Trauma. And so one of the things that I'm keen on is learning from you all about some of the atrocities that we see in tent cities after disasters. And Haiti is a good example for me. I was in Haiti, and 500,000 people living in tent cities, and the amount of health issues and mental health issues that occur in these tent cities, not talking about the disaster that occurred and the impact of that on the mental health of the population. That's one thing. But the ongoing other issues that occur, whether it be public health issues in terms of, we all know about the cholera epidemic that occurred down there, but also, what we might refer to as domestic abuse or otherwise physical abuse and sexual abuse that occur in these dense tent city communities. And Douglas and I were talking before about, is there something that can be done? And I know that's not exactly the agenda of this group, but something that could be done in terms of design of these 10 cities. I mean, UNHCR came out, just as you all know, 2 weeks ago, and we have the largest number of refugees now living in the world that we've ever had. We have 59.5 million refugees living, they're displaced from their normal homes. So it's just something that I'd like to have as part of the working agenda as we move forward.
Yeah, I think that's a really good point. I think we should definitely make that one of our work streams.
I would just say that closer to home, we have a lot of research on what happened to Katrina victims. And I know at NIH, we did a whole series of meetings and journal publications and funded a number of projects around looking at post-Katrina relocating, and people still live. You can go to New Orleans and you still see people living under the bridges in tents. So closer to home in the US, we haven't even figured out how to deal with it. There's a lot of research around it though, so I'm happy to send you links.
Sure, thank you.
So I work for the government in Washington, D.C. I work for the Capitol, and this town is filled with people who are working at all hours and very intense change. I want to change the world. So I think the stigma isn't on urban design. I think the stigma is on mental health, and I think we as a society still don't, like you said, we still look at people who have mental health problems or in a negative way. And we don't even know what mental health is, I believe. It's a general population working in a government office. We see people who are working too hard. We see people who are getting angry. We see people but we don't know what to do about it. So, and plus, we also have a healthcare system that doesn't make it easy for a person to get mental health care. So there's a lot of things that are difficult obstacles to overcome. And I think the perception of mental health and the understanding of what that means is something that is very important to pursue.
I think that might be an excellent note to end on there. So yeah, absolutely. There is so much that can be done, and quite likely lots of the reason that people are not talking about this enough is because mental health does have this stigma attached to it. It's a little bit more cool and sexy to be talking about, getting people walking because it's healthy for them physically, and there's this sort of stigma that goes over people who have mental illness on many occasions, and that's something that we really need to work through, because mental illness affects 1 in 3 people. We know that living in cities makes you 40% more likely to get depression and 20% more likely to have anxiety, and it can double your rate of schizophrenia. And these are things that we can address, and there's lots of different ways to address them, and urban design is one of those ways. And within that, very, very complex, very interesting, but let's see whether we can distill it down and try and come up with some practical solutions to this question. I'd like to thank our panel. Thanks to the British Embassy for hosting us. Thank our research associates for doing all the bar work and the meetings, and you all for attending. Thank you very much.